Hello, everyone. Welcome to IGA Interactive Workshop for members supporting your community's mental health needs. This workshop will be hosted by Kym Winter, Clinical Director and CEO of RareMinds. The aim is to explore with patient leaders the development of resources and support for their particular patient community that tackle the emotional and psychological challenges of living with Gaucher disease. Kym has over 25 years of experience as psychotherapist and counselor, supervisor, lecturer, and consultant. Her former roles include head of UK University Counselling Service, clinical manager in residential therapeutic community, and chair of psychotherapy training program. She has presented nationally and internationally of the psychological impact of rare disease. This meeting is for members only and patient carriers. The main presentation of this workshop will be recorded and uploaded on YouTube. But discussion and breakout rooms will not be recorded, so you can speak freely. So welcome, Kym. You can start now. Thank you very much.
Thank you. Thank you very much, Biljana, and thank you for inviting me to come and meet with you all. And I'm hoping this can be quite a sort of free and open discussion about supporting you to think about integrating the mental health care of Gaucher's patients and families into your organisation. So I'll talk for about 20 minutes or so, and then I thought we could go into breakout rooms and brainstorm together about what the situation is in your own particular community or country, and then come back all together and share those ideas. And please feel free to use me in that 20 minutes and ask me questions and advice and anything that I can share about our experiences so far in setting up services and supporting organisations like yourselves. So please don't be shy in asking anything at all, that's completely fine. So I'm just going to share my screen, so bear with me. Okay, can you see that okay? Yep, is that coming up okay? Yes. Okay, yeah. Perfect. Yes. So I put my contact details and the website of RareMinds on the front screen, so you can have my contact details and find out a bit more about us. But I'll give you a sort of potted history of RareMinds. We provide online counselling and wellbeing resources. We're based in the UK, and I started working with rare diseases in 2013 with one particular small organisation in the UK. And as that service grew, I then started working with another rare disease organisation and started to be approached by small organisations to set up other services, workshops within small charities and patient groups. And then in 2020, when COVID, as we all know, started to really make its presence felt, I started to be approached by other rare disease organisations. And it became apparent that if we were going to really start offering quality psychological support services more widely, we'd need to form as an organisation. So with a number of colleagues, we founded RareMinds in 2020 as a non-profit. And we partner with patient organisations, provide access to trained professional counsellors and psychotherapists with specific expertise in generic rare diseases and conditions, but also specific ones like Gaucher's, because we had very much part of our ethos that it's fundamentally therapeutic for people to speak to someone like myself, who is a mental health care professional, who has an understanding of their condition. So it's not just about a generic approach, it's about a specific approach too. And we were very aware that there were many barriers to accessing psychological support or counselling. Some of those are general, shared by members of the general population, financial barriers. but some also specific to the rare disease population that have come about as a result of misdiagnosis, low disease awareness and anxiety about whether those you are seeing will understand your condition, and what in my field we call the pathologizing of physical symptoms being misdiagnosed as psychological ones, and that's setting up another anxiety about how you will be perceived by people like myself. So we also wanted to build data and build awareness about the psychosocial impact of rare diseases and conditions in a way that was both generic and specific. So when we partner with small organisations, that's what we're holding in mind as well. How can we inform policy and good practice in integrating mental health care into rare disease care generally, not just generically, but specifically. And we've recently started providing counselling services for the Gaucher Association in the UK. So we're new to working with Gaucher patients, and we're really looking forward to being able to share some of our findings and contribute to, better care, good care for Gaucher patients across the board. Just a quick rundown what we do. We do one-to-one counselling, we do couples counselling, we run workshops. We also provide an 8 to 12 week resilience group programme, which is often for targeted subsections, parents, carers, men, mums. And we also provide training and support and supervision for support leads and healthcare professionals, and written resources for websites and hard materials. So that's a little bit about us. So that's where we're coming from. So just stepping back a bit, living with a rare disease, the need for mental health and emotional well-being support. I'm not telling you anything I know you don't know as Gaucher's patients and community leaders, but I think it's useful to recap. Something that's common across all rare disease is the low disease awareness, the long diagnostic odyssey, the mislabeling, the poor care coordination, unclear treatment pathways, multiple uncertainties, and the lack of social, financial or practical support over time. And these all have their own negative impact on mental health. So one of the things I think is really important as we talk today is that mental health isn't something that exists separately from all these other factors. There are many drivers of poor mental health or difficulties with emotional well-being. And some of them are structural and some of them are systemic. So when we are thinking about supporting the mental health of, excuse me, I don't know why that's come there, supporting the mental health of our communities, we need to be thinking about the overall systemic and cultural social aspects behind that too. So just a few bits of data here from the UAUDIS survey. Rare disease patients and carers are 3 times more likely to feel unhappy and or depressed than the general population. Rare disease patients and carers are 4 times more likely to feel they could not overcome their problems than the general population. And 38% felt they needed psychological support but don't benefit from any. And then there was a follow-up survey that UAUDIS did in 2020 about the impact of COVID during the first wave that said 2/3 of respondents felt they were suffering from depression and or a feeling of not being able to overcome their problems. So you can see that there's quite a degree of distress to varying degrees within communities that I think is, you are all here because you are aware of to some extent. So one of the things that I think is absolutely fundamental to our approach in supporting those with rare conditions in 2022 and beyond is the need to integrate psychological wellbeing needs into rare disease care. It's not something that should be off to one side or an add-on. It's fundamental to living well and coping with rare conditions. And one of the things I also feel really strongly about is that it's about normalising the emotional impact and the challenges of a rare disease. It's not something that's wrong with you if you're struggling or you're feeling overwhelmed or anxious or stressed at different points. It's perfectly appropriate and perfectly normal. And organisations like yourselves are there to support patients and families. One of the things I think it's helpful to think about is culturally sensitive practices when we're talking about mental health. Even the language we use is going to be more distancing or more accessible for certain groups. Diverse visuals are really important. Some sectors of our communities are going to feel more comfortable approaching for mental health support or emotional well-being support, depending on how you describe it. And certain other groups have different notions of privacy. I used to work a lot in an organisation where we had a very large Bengali population. And one of the things that we found is that within that population, some preferred to speak to someone from their own background and culture because they felt they would be more understood. Others felt that they would prefer to speak to someone right away from that culture because they were concerned about confidentiality or things getting back to their home families. So thinking about notions of privacy, and back to the phrase we hear a lot in working with rare disease and conditions, one size does not fit all. So one of the things I really want you to understand at this particular point is that you are all, by existing, implicitly supporting the mental health and well-being of your communities. The fact that you exist is the number one thing you are doing to support people's mental health. There are other activities that many of you will also be doing that I would include as mental health support: advocacy, awareness, lobbying, and then support for disease-specific difficulties such as financial impact. And we know that, you know, financial drivers of mental health difficulties are very much a factor. So as are pain and fatigue, all of these have their impact on the mental health of those struggling with those issues. We then move into more explicit mental health and wellbeing support, which I argue should be available for patients at diagnosis and beyond. But we know that in the statutory sector in the UK or in your healthcare systems in other countries, that's going to be quite variable. Some of you may have psychologists or psychotherapists like myself attached to medical teams, but access to them can sometimes be not straightforward, or people don't want to take it up within a medical service. Sometimes people like something a bit separate. So explicit mental health and wellbeing support, usually in my experience, divides into two aspects, and that's going to be peer-led and it's going to be professional-led. And as we move forward in the next few minutes, I think it's helpful for you to think about where are we at in our particular organisation right now. What are we doing? What are we doing well? What might we want to start doing or we know we need to do? So some of the peer-led things are the online forums, the Facebook groups, the online groups and meetups, and the buddying and mentoring schemes. And then we have professional-led services, which are things such as what myself or my colleagues offer: 8 to 10 week groups, targeted workshops, one-to-one counselling, videos, materials, or podcasts. And I think, you know, we're talking what can be helpful to think about in terms of mental health provision for your organisations is quite a stepped approach. What are we doing already and what would we like to move towards? So one of the ways to think about this is the AAA approach, is to think about, okay, you're doing the first thing by acknowledging there's a need in your communities. And I would really encourage you all to work on the basis of the ordinary acknowledgement of the mental health challenges of living with a rare condition. This isn't something unusual. It isn't something that means there's something wrong with you. There are ordinary everyday challenges. So the idea that living with Gaucher can be challenging, but we're here to support you, that statement alone is a supportive mental health statement. And that's really about integrating the language into your website, your hard materials, your information days. I'm always a big fan of inviting mental health care professionals onto trustee boards, in the same way that I always like to see them encouraged onto multidisciplinary teams. So really that idea that mental health support becomes part of a multidisciplinary approach, both within organisations and within healthcare. And as part of that, beginning to use your websites and your materials to signpost to generic mental health services, including crisis lines. And I say that because one of the things, I think, there was a Rare Disease UK report out which talked about the prevalence of suicidal thoughts in the rare disease community. And it's certainly something that comes up not infrequently with people who use our services, but I think is quite difficult to talk about often. We found that most of the people we talked to had not disclosed that to anyone else in their family or their healthcare teams. And also, it's always very difficult to know what level of suicidal thinking or attempts there are in the general population. But certainly in one of the organisations we first started working with, it was because of a suicide of a member who again hadn't disclosed anything to anyone else in their family or team. So including things like crisis lines, I think, is very important on your websites. Again, it's not making them front and centre, because obviously you don't want to say, you know, diagnosed with a rare disease, suicidal. You know, it's not a helpful way of approaching it. But again, just integrating crisis lines, support lines into the materials you have available, I think can be very helpful. I often say it's not the people, I'm not so concerned about the people who come and see us that might talk about suicidal thoughts. It's those who we don't know about, who don't approach anyone for any help anywhere. Those are the ones that are really at risk. Then it's about assessing your current provision. What do we do well? And what do we want to do differently? Do you have particular groups that are talking about different particular needs? Your young people, or your men, or your mums? Are there particular groups you think, we'd like to do more with them? And liaise with your medical healthcare professionals too, if you have any on your trustee boards or who are friendly and supportive to your organisations. Ask them, could you help us? Or are there things that you think it would be helpful for us to be doing for our populations? And then your next stage is to start addressing. And again, I would move through a system of thinking about peer support. You know, what skills and what strengths have you already got in your communities? And then start thinking about what professional support could we have to either support our peer workers or to facilitate or lead workshops or services. And one of the things that's really nice to be talking to yourselves as a group is you have a real potential, I think, for cross-organisational sharing of resources via the IGA. I know you're all from different countries and different situations, but some of the issues, it seems to me, could very straightforwardly be translated into different languages, but with different signposting to different support services that are country based. So there might be something you want to think about there as a group. Is there a way we could share resources, share working party on looking at emotional health and well-being generally? This is something I wanted to just touch on because I think it's incredibly important for small organisations and small rare disease organisations, which is, we're very aware, we've been doing some work through Genetic Alliance, which is an organisation in the UK, with community organisation leaders and support work leaders about the amount of pressure they can be under in supporting their patient members, and particularly worrying patient members, those who may themselves be under considerable pressure or dealing with very difficult situations, and look to CEOs, to support work leads to support them. And we've been bringing them together in small groups to talk about the pressures of the work and to have some support from people like ourselves in thinking together about the work. So I have a particular interest, I suppose, in you know, supporting staff and charity leads and CEOs who take an interest particularly in mental health and emotional well-being, because there can be very particular demands in that regard. But you're all working in small organisations, most staff are multitasking or lone working, and there is the double-edged sword too of lived experience where you know, many of you will be living with Gauchers in your own families. That gives you great insight into the difficulties of those that you support, but we're also very aware that sometimes those issues will touch things in your own lives that are themselves painful and bring up things for you. So thinking about support for your supporters, how do you get support for yourselves in the work that you do, is something I also want to be part of this discussion, I think, really. So I'm just going to very briefly mention this. This is a charity we worked with recently who started off very simply by building evidence by surveys and fundraising for a pilot 12-month service, which included website resources. They had informal support from a psychologist at their local hospital, and they ran 2 online workshops, and then started training regional volunteers that started running regular online meetups. And we supported them to supervise and train up their volunteers. And in the next year, they engaged a counsellor for 3 sessions a week. They again liaised with their local hospital and the Centre of Excellence and established links with the hospital team, and started to build data about the sort of issues that were coming up in the counselling service for patients and family members, and then also feeding that back to hospitals to inform practice and needs within the medical practitioners. And of course, all that data was then also used to help source ongoing funds. And then by the end of year 2, year 3, they had a fully integrated service, which meant that the counsellors were working with them to provide, again, resource materials, online workshops, continuing to train and support their volunteers. And again, just building data and feedback to support healthcare professionals in working with those with this particular condition. So I just wanted to go, it's a bit of a whistle-stop tour really, but just to give you an idea of what's going on in other organisations and other charities. Many, I think, partly because of COVID, and because I think COVID has really accelerated the conversation around mental health and given people permission to speak about it in a way that was still quite stigmatised, I think, up until very recently. So a lot of organisations are now updating their websites to include information about mental health support and acknowledging the emotional impact of being diagnosed with a rare condition. We run for people different workshops on things like dealing with diagnosis, managing uncertainty, men's workshops. We know that men can be at a different sort of risk for mental health difficulties because it's harder for them to disclose often. I think that's changing, but I think it's still very much in place. And I know when I talk to rare disease organisations, it's often mums who come or women who come, and we found that working with men, with a male therapist, made it a bit more accessible for men to come to things. Different drop-in, check-in, let's talk online groups are happening. It's one of the sort of upsides, I suppose, of the pandemic is the connectedness we all have now because of Zoom. Buddy programs, particularly for those newly diagnosed. We found 8 to 12 week resilience groups are something that people often quite enjoy and can be very, very moving as well as quite fun actually, and help people form micro communities of support after those courses are finished. And then, as I said before, we also do couples work and one-to-one work. So I've talked a lot, and I feel like this is a good point for me to hand back to you. What I think we could do at this point is I'd like you to start a conversation with others in this group about sharing ideas of what you're doing already, what you'd like to do, and then perhaps think about one thing you could do this month to make a start. You know, you've obviously all come to this webinar because you have an interest in this area, which I suspect means that you have ideas of things that could be being done. You're wondering about how to do them, or you're looking for ideas. You want to sort of say to other people, how are you doing it? What are you doing over there? This is your opportunity to have a chat with each other about that. And then we can come back together as the big group and just share ideas around that. So yeah, well, I was just interested really to know if any of you wanted to share what came out of your groups and what you shared amongst yourselves, and particularly things that you might feel, you know, either yes, this is something we could progress really easily, or this is something we feel a bit stuck on, and see if we can work as a group, or I might be able to help.
Okay, I'll say something. Yeah, I hate quiet. So, okay. Well, the thing is, we realize that in different countries, the situations are different. So sometimes, even if you provide, you know, support, it turns out that people are not don't want it because, you know, that's the mentality in the country. So they don't even try to get help for mental health. But in some countries, like in USA, there is, you know, people are aware they need it, but they can't get an appointment because there is lack of such services, you know. So it's and it's good when you have it provided by the government, but when you talk about rare diseases, the government support is not as good because those psychologists don't deal with such cases, you know. They usually deal with depression or stuff like that, but not like about focused on rare diseases. So like in North Macedonia, our organization actually pays the a couple of like 5 people to you know, care for the patients, psychologists. So, but they were trained before that. So first we trained like 20 people. And then we offered cooperation to work together with patients and families with rare diseases. And also, you know, sometimes you have the problem, there is government support for the patient to get psychological support, but there is no for the family, which is a problem, or for the brother and sister, the siblings, you know. So we changed that here by offering not just to the patient, but to the whole family. And so there is, you know, for the patients, there is also family therapy, and there is also peer-to-peer support. So that's nice. In some countries, they're still trying to actually group people together to make them talk about their issues. So it's everywhere is different. So this is, you know, somewhere you need to start with raising awareness, and somewhere with getting the governments to pay for this support.
I think you're right, and it sounds like you've been very creative in your country about bringing people together to say, okay, what do we need and how are we going to provide it? I think there is something that's really key about the language you use to describe emotional support. And I often, you know, although we ride under the banner of, you know, mental health for rare disease, it's what we do. But often when I work with organisations, I say it doesn't really matter how you describe the support you do. It's about offering it in a way that's going to be able to make it be taken up by your population. So it's where often I think using the language of emotional well-being is a bit softer. But, you know, you will know in your own countries what is a better way of describing support services for your particular population. I mean, we have a similar situation in the UK. We found a lot of rare disease patients were not being taken up by statutory services, psychologists. We have a system called IAPT in the UK. And patients either were being screened out of access to counsellors and psychologists through that, because people were going, rare disease, we're not sure about that, you don't fit our criteria. Or the sort of support they were being offered just wasn't helpful. You know, they were being sent on generic anxiety management courses. So, you know, so that's why I think a lot of organisations in the UK have just said, actually, we know best what patients need, so we're going to step into the gap. But obviously, you know, that's not ideal, and it still needs to go alongside lobbying for, you know, state or healthcare provision, depending on the situation in your country. But I always think, you know, this is about getting creative, asking your communities, how can we help you? How can we help you? What would make a difference to you? And sticking with it, because particularly in the area of mental health, people are very wary of stepping into being visible, that they might need some support. So I always say, be prepared to be there for the long run. You know, build resources in, build materials into your websites, speak about it openly, and gradually it just becomes part of the culture. It's part of what you do. I always think it's a bit like, you know, when someone has a baby, you know, everyone goes, oh, you've had a baby, it's really stressful, how can we help? It's almost kind of having that same approach when you're diagnosed with a rare disease. Oh, you've been diagnosed with a rare disease. Oh, that's really stressful. How can we help? It makes it ordinary, that it's, you know, something you have to kind of get used to, you have to work out how to do, you have to work out how to live with the condition.
Yes, but in our breakout room, we came on the point that Gaucher disease is very hard evidence matter until now. People are struggling and for a good diagnosis, a good treatment, availability of treatment. That's really hands-on. How is your infusion going? So it is a completely new thing in Gaucher country.
See, I suspect this is where we talked about implicit support and explicit support. You know, a lot of what your organisations are doing already are implicitly and fundamentally supporting the mental health of your communities by the stuff you do, lobbying, talking about access to treatment, supporting people with finding their way to the right healthcare professional at the right time. So I certainly don't want you to think someone like me is coming along and saying you're not doing enough. You're doing a lot already. You're getting the underpinnings in place. But I think it's also about being able to start conversations in a very ordinary way with patients about how are you coping? How are you feeling about all this? How are you managing? It's not easy, is it, being, you know, a parent to a son or a daughter with Gaucher's, or a partner? You know, how are you finding it?
Well, my experience was that my mother, who's now quite an old lady, in every meeting of our association, I saw her talking with other parents, sharing experiences, just asking, and how do you do that? And what we came in our breakout room in the end on the essence of peer meeting, peer support. I have Gaucher too, or I'm a parent of someone with Gaucher patient, and yeah. There is this saying of what you have in your heart is in your mouth, on your lips. Everyone with a cup of coffee or something like that want to talk about it, want to share it. It's human.
And I think, you know, those peer opportunities to meet up online or, you know, in person are absolutely invaluable. I'm conscious too that you know, not everyone does feel able to access those sorts of groups, either because they're a bit frightened of groups, or they're not always ready at a particular time to talk about the impact of the condition. So I think it's something about how we as patient communities broaden the net to make ourselves as accessible as possible to a wide group. Some people are just more comfortable talking individually. Some people are more comfortable talking in a group. I know from some of the peer groups that I've been asked to help facilitate, sometimes too they can focus on sort of information giving. You know, how have you found this treatment? How have you had access to it? Have you had this support? And that's very useful, but sometimes there's also another layer of being able to talk about how someone might be struggling, or how they integrate the impact of the condition into their life more generally. Sometimes that more emotional conversation, we can be a bit wary of getting into. And sometimes that's fine, but sometimes there are others who might need that conversation, or might want that conversation. So it's back to that one size doesn't fit all, I suppose, offering a range of support.
But I suppose many attendants have the experience that when you have a meeting, just any other ordinary meeting, the first half hour or hour, you talk about facts and then hard things. And then after some time, it's also in a bedside discussion. After an hour or so, people go to another level of, okay, and yeah, I'm talking about now about the technicalities of an infusion, but well, I must say I'm rather scared of it. That's not the other level, and sometimes it takes time. You've go through that tough discussion where you uphold the image of being tough and being technical. Yeah.
Sometimes I start the conversation with, asking about the good things, like what was the best since you got the diagnosis, since you live with this disease. And then I ask about what was the worst, and do you need some help with that? So,
yeah. And also I think what's really helpful is, of course, in your communities, you've got a mixture of those who can sort of model living with the disease over time, know how to do it. You're sort of there up as, we've been doing this, we know how it works, we've been there, we've done it, we've worn the t-shirt, and how helpful that is for newly diagnosed people coming in, that they can look to the sort of the old hands with the condition. And that, I think that does count for a lot in communities, and bringing those two groups together. I think one of the things I'm always mindful of is, when I sometimes talk to patient communities, often there are familiar faces that re-emerge again and again in meetings, or are engaged by the organisation. And yet we know that there are often many who are diagnosed that don't engage with communities so easily. And I think I'm often mindful of how do you reach out to those groups who may be more vulnerable in certain ways. Those who can come to meetings and events and groups, great, they're engaged in some way, but it's those who are out there who aren't joined up. And I guess that's where it's, it's back to offering a range of resources, just being able to say things on your website like, we understand it can be difficult, we are here for you. But sometimes those who do want to make a more individual approach can take up quite a lot of time in patient leaders, and I know you are working in very small organisations, and can cause some worry too. So I suppose that's about, again, being able to join up with each other, or someone like me, to think through, if you do have people that you're worried about or you're not sure about, who would you go to? Who would you approach? Would it be someone through the hospital? How would you talk to that person about how they were struggling to enable them to get more care. Things like that, I suppose.
Yeah.
Really.
In our organization, we had a patient contact person, somebody with a psychological orientation, but with a disability allowance, and we had a patient group of some 80 patients or so. So it was handleable, and she kept in contact also actively with those members that weren't keen on coming to a meeting. I remember we had one patient member who was a Jew and didn't want to know for his friends and families, etc., that he had Gaucher disease. Always the magazine in a white envelope, etc. And of course, now and again, she called him, "How are you?" And she was also able to have a good relationship with the nurses in the central hospital, so she could discuss more general things, of course, and refer to help people to come to specialists or other help.
It could act as a bridge between patients and organisations or health.
As a first responder. Yeah.
I'm just aware of the time, and I know this is about an hour, this webinar, so I don't know whether, I imagine you've all got pressing other things to do as well, but I'm very grateful that you've given me an opportunity to come and meet with you all, and I'm very happy to be contacted if we can help at all with advice. We've also got some free resources that we've just got some lottery funding that we're going to make available, so I will share them with Sarah. I guess, Sarah, you can share them. I can share them with Sarah and Angel to forward on. Would that be useful?
Yes. That would be great. Thank you.
We've made a little animation about looking after your emotional well-being, and I believe that you can use YouTube to translate into different languages. You might have to use your IT people who are more competent than me. Does that sound right? Does some of you know of that function?
No.
Okay.
Yeah.
Great.
I can also add that Arina and I and Maggie Abdelwa from the IWGD are finalizing an article and a guideline on self-management, including the role of psychological support and then peer support, etc., in empowerment of patients. It is a general overview to help you all in your situation to discuss it with your clinicians, etc., about how to support everyone. But we are working on it still. It's going to take some extra time, and hopefully we can also address it in the IWGD meeting in May.
That sounds great. Really lovely to meet you all. Thank you very much. Thank you, Juliana.
Thank you.
Thank you very much.
This will be uploaded on YouTube, and I hope we will have translations also. Thank you, Kym, and thank you all for sharing.
Nice seeing you all. Bye.
Bye.
Thank you.